I am Mindy Mesmer. I'm the chair of the SB 85 Environmentally Triggered and Chronic Disease Commission. And we have with us today Lynn Clement from New Hampshire DHHS to talk with us about radon. And so I'm going to turn it right over because I know there's a scheduling issue and we'd like to let her go ahead right away if that's okay. So if you need to share, you should be able to share slides or whatever, Lynn. And I'll let you just introduce yourself if you don't mind. Or if Michelle wants to, that's fine too.
I'm happy to introduce Lynn. I just have a couple words. So Lynn Clement joined the department in 2015 as a communications specialist working in the Environmental Public Health Tracking Program. In about 2021, Lynn was asked to lead the New Hampshire Radon program. And as a program manager, she is committed to raising awareness of the health risks of radon exposure and increasing testing and mitigation in New Hampshire's homes, schools, and buildings. As a consummate marketing professional, Lynn also runs our social media channels for the Division of Public Health Services, provides recommendations for data visualization on the New Hampshire DHHS data portal, and promotes the division's environmental health conference and is a member of our environmental health integration team here at DPHS. Prior to joining the department, Lynn was a senior marketing manager at Economist Conferences in New York City. So we're so thrilled to have Lynn here, and I'll turn it over and she can give you information on the radon program.
I don't think I have the capability of sharing. I see host disabled, participant screen sharing. Oh, there it goes now. Okay. Are you seeing, which one are you seeing? The large one or the notes?
We see the large one.
Okay, perfect. Thank you. Okay, so thank you for that introduction and thank you for allowing me to be here today to discuss the radon program. I'm going to discuss a little bit about what radon is and how it seeps into homes, the health impacts of radon exposure, radon prevalence in New Hampshire, radon testing and mitigation, New Hampshire policy, and some of the outreach that the program currently does. What is radon? Radon is a tasteless, odorless, colorless, naturally occurring radioactive gas that is harmful to your health. It comes from the breakdown of uranium in rocks and soil, and it's measured in units of picocuries per liter. All outdoor and indoor air has some radon in it. In the US, the average level of indoor radon is 1.3 picocuries per liter. In New Hampshire, samples collected from homes from 2007 to 2021 suggest that 37% of homes have a concentration of 4 picocuries per liter or higher, which is the Environmental Protection Agency's, the EPA action level. The EPA recommends homes be fixed if the radon level is 4 picocuries per liter or more. There is no known safe level of exposure to radon, and therefore the EPA also recommends that Americans consider fixing their homes for radon levels between 2 and 4 picocuries per liter. Radon can build up in the air in any home or building, whether it has a basement, crawl space, or is on slab, is sealed or drafty, old or new. Radon travels in small spaces in soil and rock under our homes. As pressure differences are created around the house, any radon present in the soil moves along the path of least resistance from high to low pressure. Radon enters homes most commonly through cracks in foundations, openings around sump pumps and drains, construction joints, cracks in walls, crawl spaces, and in some cases, well water. Radon in well water can be released into the air during showering, dishwashing, and laundry. Breathing air with elevated levels of radon can increase your risk of lung cancer. Nationally, radon is the second leading cause of lung cancer, and radon is the leading cause of lung cancer among non-smokers. A person's lung cancer risk from radon depends on the level of radon in the air they breathe, how long they're exposed, and whether or not they are a smoker. Smokers exposed to radon are at an increased risk. Anyone is at risk of getting lung cancer. When you breathe in radon, the radioactive particles from the decay of the radon gas can get trapped in your lungs, and over time, lung cancer can develop. The EPA and the Surgeon General's office estimate radon is responsible for more than 21,000 lung cancer deaths in the US every year. In 2005, the Surgeon General issued a health advisory stating that indoor radon is the second leading cause of lung cancer in the United States, and breathing it over prolonged periods can present a significant health risk to families all over the country. And it's important to know that this threat is completely preventable. Radon can be detected with a simple test and fixed through well-established venting techniques. In New Hampshire, potential exposure to radon is greater than the national average due to our granite bedrock. These maps show the relationship between estimated levels of radon in groundwater, which is the map on the right, and indoor air radon testing results of households with elevated radon levels, the map on the left. The darkest colors on each map represent the highest radon concentrations. And it's interesting to note that where there are higher concentrations of radon in groundwater, so are there higher elevations in indoor air. Our data analysts recently mapped at the town level the results of nearly 33,000 test results from external labs from 2007 to 2021. The map shows the percentage of test results at or above the EPA action level of 4 picocuries per liter. The darker blue colors indicate towns where 45% or more of the homes tested at or above the EPA action level. The lighter blue indicates towns where 30 to 45% of the homes tested elevated, and light green indicates up to 30% of the homes were elevated. The beige are towns that do not have enough testing data to report test results. The key points that we'd like to take away from this are that 37% of homes tested in New Hampshire report elevated radon concentrations at or above the EPA action level of 4.0 picocuries per liter. The median concentration varied by county, ranging from 6 to 9.1 picocuries per liter. And values above 100 picocuries per liter have been reported in every county.
Is it all right to ask a question?
Sure.
If you go back to that previous slide, I'm just wondering, it looks like the highest levels are in the most populated parts of the state. Is there a correlation there? Except for the North Country, but everywhere else it seems to be that's the highest population areas.
Well, I think that's kind of just, it shows where there's increased testing, but yes, we know according to the EPA map that was done many, many years ago, Carroll County does seem to be the one that shows the highest or the highest risk on the EPA zone map, but the whole state has elevated concentrations. And we have been seeing between the map that we previously did, we do have a version of this map that was up to like 2013. And then this new map, we do always see that the southeast of Martin does have the highest concentrations.
Okay. All right. Thank you.
So this map is from the US Geological Survey, and it reveals the probability of radon in groundwater over 2,000 picocuries per liter. Areas shaded in darker to lighter green represent 1 to 40% probability of elevated radon in groundwater. Yellow to orange shades represent 40 to 70% chance, and areas in shades of red have a 70 to 99% chance of radon in groundwater over 2,000 picocuries per liter. The radon advisory level for concentrations in well water begins at 2,000 picocuries per liter if the air radon concentration in the home exceeds 4 picocuries per liter. And so some key points here is that more than half of the New Hampshire groundwater has 50% or higher probability of radon levels above the radon advisory level. The primary route of exposure is inhalation, and radon in water can contribute to the radon in the air. The only way to know if there's radon in the home is to test for it. The amount of radon in the home depends on many factors, including the geology, construction, and mechanical systems. The New Hampshire Radon Program provides free test results to all residents. Test kits are also available online or in home improvement stores. And you should test your home every 2 years or after any renovations or changes in living patterns. And that includes if you have a mitigation system, you should still continue to test your home. Sometimes water can contribute radon to the air in a home and needs to be treated. So activities like taking showers, doing laundry, or running the dishwasher can release radon dissolved in the water into the air. And 10,000 picocuries per liter of radon in water equals 1 picocurie of radon in air. So when radon and air levels are at or above the action level and water comes from a well, testing the well water for radon may help in determining the most effective way to reduce the radon and air levels in the home. The New Hampshire Department of Health and Human Services and the New Hampshire Department of Environmental Services recommend that homeowners with private wells with radon concentrations at or above 10,000 picocuries per liter install treatment for the water in conjunction with mitigation of the indoor air radon. And for private wells with radon concentrations between 2 and 10,000 picocuries per liter, the treatment of water may be advisable if the air concentrations in the home exceed 4 picocuries per liter. So action should be taken when radon is in the air is at 4 picocuries or higher. It should be considered when radon in the air is between 2 and 4 picocuries per liter. And radon levels in air can be reduced by installing a radon mitigation system. In most cases, a radon mitigation system involves drilling a hole in the basement floor and installing a vent pipe and a fan to reduce the radon entry into the home. Costs for a radon mitigation system range from $1,000 to $3,000, depending on the size and the type of the home. And radon can also occur in private well water. Radon in well water can be removed with a water aeration system, which ranges in cost from $4,000 to $6,000. Homeowners are always advised to consult a licensed radon mitigation professional to discuss the best solution for their home. The cost to install a mitigation system may not be feasible for some homeowners. There are limited resources for homeowners, such as the USDA Single Family Housing Repair Loans and Grants. These are also known as Section 504 Home Repair Program. And this program provides loans to low-income homeowners to repair, improve, or modernize their homes. Or grants to elderly low-income homeowners to remove health and safety hazards. A person's flexible spending account, health savings account, or health reimbursement account. They may be able to use these funds if a medical professional recommends and provides a letter of medical necessity. And the U.S. Department of Housing and Urban Development Lead Hazard Control and Healthy Homes Radon Testing and Mitigation Program. HUD is developing a department-wide policy that identifies radon as a radioactive substance and addresses radon testing and mitigation requirements. Providing a free radon test without funding assistance does not save a life. The program is currently evaluating ways to collaborate with other programs and external partners to provide more assistance to those most vulnerable. The New Hampshire Radon Program conducted a radon policy review last year. New Hampshire currently has 2 regulations in place. One is for real estate disclosure and national certification for mitigation, which is common across the region. So the first one, New Hampshire Revised Statute, Section 477, requires that prior to executing a contract for sale of real property, the seller must provide a buyer with a statement about radon and radon testing and mitigation techniques. The other is New Hampshire Revised Statute, Section 310. Any person engaged in the design or installation of airborne radon mitigation devices in New Hampshire shall hold a current certification from either the National Radon Proficiency Program or the National Radon Safety Board. It should be noted that we are not able to enforce this statute since we do not have a state licensure program. And also there are no state requirements for landlords to test for radon in rental units. The radon program began providing New Hampshire residents with free short-term charcoal radon test kits in October 2021. There have been 10,000 test kits distributed with a return rate of 43%. Of that 43%, 1,650 homeowners have received notifications of elevated radon test results at or above the 4 picocuries per liter and were advised to take action to fix their indoor home air. Another 918 homeowners have radon test results between 2 and 4 picocuries per liter and were advised to consider fixing their indoor home air. Our outreach and education strategy relies heavily on the use of social and digital media, with ads running on our internal accounts and externally on Google and iHeartMedia channels. We provided the regional public health networks with tabletop banner stands and literature folders and printed fact sheets for them to display. The banners contain QR codes that take them to the radon test kit order form. Fact sheets are available in English and Spanish, as is the test kit order form. We provide test kits to our research partners at New Hampshire Biomonitoring and the Dartmouth Cancer Center, and we have created a data story to improve the public's understanding of the importance of testing for radon and taking action to fix their indoor air quality if needed. In September 22, the New Hampshire Radon Program was asked to participate in a radon pilot study led by Dr. Rian Hassan of Dartmouth Hitchcock Medical Center and Dr. Judy Reese of Dartmouth Cancer Center. This is a poster that was presented by Dartmouth Cancer Center at the Air Quality Conference in Salt Lake City in March 2023. The Vermont and New Hampshire radon programs are both part of this pilot test. The poster features some general background data on radon, including that thousands of homes in New Hampshire and Vermont have high radon levels, but no mitigation systems. And approximately 150 people die annually in New Hampshire and Vermont because of radon. Dartmouth used a population survey to offer the New Hampshire radon program's free test kits, and we provided the results data for New Hampshire. The objective of the study was to evaluate socioeconomic factors and cancer beliefs associated with previous home air radon testing, mitigation, and for those who had not yet tested, the acceptance of the free test. The study found that those who had not previously tested had lower educational attainment, were less likely to be married, were less likely to be homeowners, and were more likely to express negative attitudes towards cancer prevention. The paper, entitled Understanding Residential Socioeconomic and Behavioral Patterns for Home Air Radon Testing, a population-based study, was submitted to Environmental Health Perspectives in January 2024. Working with radon professionals, we provide a forum for discussion, offer training sessions, gain support for policy, and collect data through a voluntary survey. We formed an advisory group that is made up of internal and external partners and radon professionals, and this is just a great way for us to keep our finger on the pulse of what is happening locally. And finally, working with the Colorado Radon Program, we adapted their 5th and 7th grade science classroom materials to meet the New Hampshire's Common Core and Next Generation Science standards. Materials include lesson plans, teacher and student booklets, and presentations. The initiative also includes hosting a school poster contest with prizes and submitting the New Hampshire winner to the National Poster Contest. And working with the Department of Education, we added 3 radon testing questions to the Indoor Air Quality Survey. We are requesting that health officers speak with schools that complete this survey about the importance of testing their school buildings for radon. And then coming soon, we are partnering with a local home inspector to host a realtor training on April 17th, offering reimbursement to home builders who complete NRPP-approved courses in radon-resistant new construction, developing a training for school facility managers on testing schools for radon, utilizing the New Hampshire Radon Program's continuous radon monitors, producing a training video on how to test your home for radon, and distributing brochures to libraries. Thank you, and I'll answer any questions if there are any.
Any questions from the commission for Lynn? Representative Murphy?
Oh, thank you. Well, Lynn, could you go back to that? You had the list of the state requirement. Wait a minute, let me just say, that there was no state requirements for landlords to test. There was no school test. Yeah, that's the one I wanted to say.
Yeah.
Wow, we're pretty behind the other New England states in terms of what we're policy, at least.
Yeah, Maine and Connecticut and Rhode Island certainly are leading the way.
And if I could follow up, the school testing required, I'm sorry if I missed this. Is that testing of the actual school building? In the
Yeah.
school building? Okay. Wow.
Representative
That
Murphy,
is-
did you have something more to say about that?
Yeah, so I'm just
Okay.
wondering, it says the national certification for mitigation is required, but if we're not testing, what does that mean? How,
So national certification, so in order to be a mitigator, a mitigation professional who installs systems,
okay,
national certification. What we are seeing is that there are home builders who are installing systems as they build new homes, but they don't have the certification to install a system that we say is required.
do you have suggestions, Lynn, about things that policy wise that maybe we need to be looking at? I mean, it really concerns me that there's no testing required in our schools. If 30, I think you said 30% of the homes tested are it's present. I mean, if we're not testing the schools, we have no idea.
Test schools, we don't test public buildings either. I mean, I think one of the issues that I think concerns me the most, that I always feel, the most, I feel the worst for, is the test required for rental property, which you'll see only Maine actually requires that. We do have elderly people calling us, condo owners calling us, saying that, they tested their unit for radon and it came back elevated, and they really have no recourse. They can't, if the apartment or landlord does not mitigate the building, they have no recourse. I had somebody who said, wanted to put in a mitigation system in his condo, and the condo association board said that aesthetically it wouldn't look nice, and so they refused it and they denied it. I do think school testing is important. We do have some continuous radon monitors. The state owns 10. And so we are looking at holding a training session with school facility managers. I'm actually presenting at their meeting on February 29th to address this. I spoke with somebody at the national conference on radon back in October, who said the majority of the time, the mitigation for a school revolves around adjusting their HVAC systems. So I think the concern always is, if we go in and we test a school building, it comes back with elevated levels, who's going to pay to install a system? A lot of times it's not about installing a mitigation system. It's about adjusting their HVAC systems. So I do think the school testing to get that required would be obviously mitigation with it. You don't want to just test it. You want to mitigate it. You want to have them work with that. And then also doing something for rental properties. I think if you're a homeowner and you choose not to test or mitigate your home, that could be said, it's on you.
Right.
But for rental properties, I think, those people don't have much of a choice, and some of them are afraid of being evicted.
Thank you. Just one more question. Do you know, has there been legislation proposed in the past to make either of those things, to regulate either of those things, or has it just been not brought forward?
Not that I'm aware of.
Okay.
The one state
Thank
that
you.
surprises me is Massachusetts.
Right.
Is that a function perhaps of the geology around New Hampshire, that they don't have as much of an issue?
Could be.
Yeah, at the time that we created this policy scan, I sent it to my colleagues in each of these states and requested that they review it to confirm
Yeah.
that it's correct. But we didn't go into much of the reason behind
Mm.
why some had and some didn't.
Well, all I can say is thank God for Vermont.
Yeah.
At least we're
This
not
is
low,
the-
the lowest one.
Excuse me for a sec. I
Well,
just wanted to mention that Dr. Kazal, who's representing the New Hampshire Physicians Association, and Dr. Timmons have joined us. So any other questions? Chris, do you have any other specific questions
Just
for
a-
Lynn
a
right
quick-
now?
A quick
Oop.
comment on Massachusetts, just looking at that, a third of the state is above 4. So that's very interesting that you'd think that they would be a little more aggressive of some of the New England states, but looks like a third of the landmass is above 4, and nearly all of it is between 2 and 4.
Thank you. Michelle,
Wow.
do you have a question?
I don't have a question, but I do know, in the past, I think there have been some legislative initiatives to test for radon during property sales. I believe that there's been attempts at that. So I just wanted to bring that that awareness to the group.
Great. I'll go back to Chris. Did you have another follow-up question, or is that it for you?
No,
Okay.
that was it.
Rosalie, did you have a question? I see you popping up.
Yes. I have a few questions. So does Carroll County have a higher rate of lung cancer than the rest of the state?
Oh, I would have to look at the lung cancer data in the DHHS data portal to answer that.
And the other concern I have is, one of the symptoms of, because there's no medical test to see how much radon is in your body, the children are at a higher risk. It'd be very interesting to see if children are being diagnosed with lung cancer in the high level areas in our state. And the other concern is, one of the symptoms would be, coughing or wheezing. And I'm wondering if they go to a pediatrician's office, if the parent is complaining about my child is coughing a lot or wheezing, and they're diagnosing it as allergies instead of thinking about, radon in the house.
Well, I will say it does take a while for lung cancer to develop. One of the initiatives that we'd like to get to is actually creating a clinician fact sheet and working with clinicians so that when there is a lung cancer diagnosis, and it is with the non-smoker, that the clinician does ask that person, have you tested your home for radon? Again, back at that conference that I was at in October, I listened to a story of a woman who was diagnosed with lung cancer and was just pretty much outraged that her doctor never asked, or informed her to test for radon. It wasn't until several months later that a different an oncologist said to her, have you tested your home for radon? And that's when they discovered that there were very high levels of radon in the home. So, part of the program's goals is actually to work with clinicians and have them at the early stages when they are getting these lung cancer diagnoses to ask people to go back and check their homes for radon.
Do you know any municipalities in the state that have high levels of radon in the public drinking water?
I would defer that to DES because they're the ones that regulate public drinking water.
Because I know in our town, we do test for radon and we don't have radon. And my very last question is granite countertops. Is there a concern to have granite countertops in your home? Do they emit radon?
I have never heard anything about granite countertops as being a concern.
Thank you very much.
I see Peg has her hand up. Peg DiTullio.
Yes, thank you. Lynn, is there any evidence or any data on homes built on slab versus homes with basements in terms of the amount of radon and air can we safely assume, for example, if a home is built on slab, that there would be less risk in terms of the air radon? Now, the water would be different, but do you know anything about that?
The data shows that it doesn't matter if your home is built on slab, if it has a crawl space or it has a full basement.
Okay,
You still have elevated radon in the air.
okay, super, thank you.
Any other questions from commission members?
All I can say is you ended with a bang with this chart. It's very,
So I have
really,
a few questions about the water side. Lynn, would you mind going back to the slide with the side-by-side map of the radon in air and water? So do we have any idea what the relative contribution in areas where there's high radon and groundwater is to the high indoor air concentrations is? And that'll be the first part of my question. So is it in those areas where it's red or orange or high, or is there, you know, a relationship between, it looks like there is just by looking at these two maps for sure. But do we know what the relative contribution is to the indoor air from the water levels?
No, we don't. No, this was a US Geological Survey. And so this is just showing where, you know, radon in the groundwater levels are estimated based on the bedrock type. So we can see, like I said, you can see that there's some sort of correlation here. Especially down here where you see higher levels of radon in the groundwater.
So there's no radon well testing data available, or maybe that's a DES question. It'd be nice to be able to see an overlay of that.
Well, homeowners don't have to test their well water.
I know.
So, yeah, it might be a DES question. The work that we did really was around this town level risk map, which we are actually looking to update again this year because this went through 2021. So we are hoping to update it again and get some more test results in. This is actually efforts of a partnership and just really establishing relationships with some of the external labs. So we use Alpha Energy Lab to distribute our free radon test kits, and we get the test kits from them, but we've also gone to Radon Away and Air Check, and they have provided, just based on our relationship, they have given us our New Hampshire data. And so we're able to map it at the town level.
Okay. I don't know, I can't remember, but I think it's DHHS that did the biomonitoring programs, right? Or were those led by DES? Because I know radon was part of those, right? And the well
Yeah.
water.
Been giving biomonitoring. We've actually been working with several internal programs where we distribute the tests to them. Biomonitoring is one of them. We gave them about 200 test kits, and they have been doing a study where they've collected their samples along with the radon in water. I don't think their study is complete yet.
Okay. So maybe we
Mindy,
can talk about that.
Just to answer that a little bit more, so biomonitoring is within the Department of Health and Human Services, and they are coming, I think it's in June, they'll be presenting, so they'll be able to provide some more detailed information to that.
Okay, that's good. So where this is leading me to is, you know, New Hampshire doesn't have any groundwater protection or drinking water protection levels, nor does EPA yet. And I know EPA has proposed some, but I'd be interested, and I don't mean to pressure if this isn't in your wheelhouse, and maybe we need to wait for the next couple of presentations to know this, but you know, is there or have there been some efforts underway to pass an MCL for radon? Because clearly radon is an issue in New Hampshire.
So I'll jump in there. Typically, the Department of Environmental Services would be the agency that sort of oversees that area. So I would defer to them, but certainly, you know, we work pretty closely with them on any of, you know, with the radon program, with the biomonitoring program. So I think that might be directed more at DES than here at the health department.
Yeah, and I don't want to speak for our Drinking Water Groundwater Bureau, but you know, I'm happy to bring questions back to Brandon Kernan from this commission so that I can provide more detailed responses. But getting a little bit at if I'm understanding the question that you asked previously about sort of the relationship between radon and water and radon and air, you know, we would recommend that everyone tests their home air for radon, but where we see radon in water, that would be sort of an added sort of indication that testing is warranted. But like I said, everyone should test anyways, because there can be a contribution of, you know, in addition to sort of intrusion through the bedrock, if radon is in water, it can off gas, you know, when someone's taking a shower or running the water and contribute to the level of radon in the home. I don't know if that answers the question.
Yeah, I guess, you know, I know on June 14th, we're going to be hearing from the biomonitoring people. So maybe that could be added to the agenda for that, talking about the radon results too. And I guess, you know, this commission, one of the first things the commission set out to do when it was formed was that pilot study on arsenic levels. And that kind of fed then into some of these other programs that are ongoing. And so I would like to close that loop and, you know, because these are the types of things that will inform policy needs. Clearly, if, you know, there's absolutely no MCL or any kind of drinking water regulatory limit, that's an issue, especially with such a high prevalence of, you know, geology in New Hampshire that would contribute, you know, radon to groundwater. So I would like to hear about that in a future presentation, if you don't mind. And that's another area where, you know, I'm particularly interested in making sure we're covering the bases. Peg, did you have your hand up again? Oh, okay. Any other questions for Lynn? Okay, seeing none. Well, thank you so much, Lynn, for coming. I've asked Michelle if you wouldn't mind sending your slides over after the meeting so we can share them with the commission. That would be great. But I really appreciate you taking the time to come and speak with us.
Thank you.
I'm sure everybody else does too.
Thank you so much.
Thanks, and you're welcome to stay if you wish, or if you need to go. I know you had a schedule issue, so.
Thank you. Have a great afternoon.
Thank
You
you.
too. Great. So next on the agenda was updates from the regulatory agency representatives. Do either one of you want to take the start, or do you have anything to talk to us about? I always leave that as an opening on the schedule so that you can communicate with us if you need to.
I'm happy to start if that works. I have a few updates. So our program is feeling the effects of the continuing resolution at the federal level with respect to our grant funding, and especially within the environmental health program. So while we do expect to get our full award from the Agency for Toxic Substances and Disease Registry for our apple tree program, because of the CR, we have been asked to cut our budget significantly with the expectation that the remaining amount will come at a later time. So just something to keep in mind, you know, about how our state is impacted, you know, by decisions made at the federal level.
Karen, can I ask you to expand on, sorry, so this is the first I've heard of this. Can you, and maybe for others as well, can you just explain that a little bit more in detail for us?
Just so while the budget is sort of in limbo at the federal level and there isn't an agreement on the federal budget, you know, I think different federal agencies respond differently to that. So, you know, we haven't gotten notifications like this across the board for other grants from CDC or EPA, but the Agency for Toxic Substances and Disease Registry, the way that they manage the impact of a continuing resolution at the federal level is to have you sort of cut down your budget for the, you know, we're cutting it down to like a quarter at a time. But historically, when that has happened, you know, our funding has come through. So, but it's
what does that mean though, Karen, in terms of like staffing or program? How does that?
It's not impacting staffing at this moment, and the hope is that it won't. Because so historically when this happened, you know, we had to cut our budget basically and submit our yearly budget in two separate components for like half a year at a time. So we ultimately got the money, but just had to sort of, there are some additional hoops to jump through essentially.
So do you have to stop, like if it was some grant or something or a program, you have to stop whatever you're doing and then just wait for the next round of payments to come in? Or, I mean, if people are working on a,
No, and we're able to, no, because we expect that we'll be able to get the next installment sort of, that it will be settled within the next few months, right? And we actively work on figuring out backup funding by supporting other programs throughout the agency.
thank you.
So another update is that there have been several community input sessions to inform the development of an updated climate action plan. So our draft priority climate action plan is due in the next couple of months, and we expect implementation funding to follow that. So our department will be working with community partners to submit an implementation grant to be able to carry out work and strategies identified in the priority climate action plan. I do want to note that it's not a comprehensive climate action plan. It's very focused, based on the funding requirements, narrowly on pollution reduction strategies. And I just wanted to say, stay tuned for a more detailed update at a future meeting. We'll be joined by James Tilley and also Kurt Unling, who will talk about the process for community engagement and how they worked that into the development of the priority climate action plan. So some of the draft measures have been released for public comment. And after I'm done giving updates, I'll put a link in the chat if people want to review those strategies and want to weigh in. I can't remember how many meetings were held statewide. I want to say 9 or 10 in-person meetings plus several online meetings in an effort to really reach lots of people and get input from all over the state. So if there are questions about that before the next update, I'm happy to answer. Okay, hearing none. Oh, sorry, you might have heard my kiddo sneeze in the background. DES Air Permitting hosted a public meeting in Nashua on February 12th to discuss a proposed asphalt plant in that community. While the city has denied the application for building that facility, New Hampshire DES is in receipt of an air permit application, and we're bound by statute to review and issue a decision on that application. It's a parallel process to the city's process, so their decision doesn't impact our decision. Our agency's decision isn't a statement on or have any impact on Nashua's decision. And both approvals are needed for the facility to be able to move forward. The purpose of the meeting was to provide information to help community members to understand not only the air permit process, but also to understand how to participate in that process so that their voices can be heard. And if people are interested in that, I can provide a link if you want to sign up for the interested parties list for that application. Multiple community meetings were held earlier this month to discuss PFAS related research that the department is participating in alongside academic partners. Those sessions were recorded. I don't know if they've been posted yet, but I can be sure to send along the links once they are posted. Our toxicologist, Jonathan Batali, helped to coordinate those sessions. And a lot of the content was about research that he's involved in. Another update is that the Southern New Hampshire Public Water Health Consultation that the Agency for Toxic Substances and Disease Registry is completing is now in the e-clearance process. So we do expect that to be released, hopefully within the next few months. I'm not sure exactly how long that e-clearance process will take and if they're being impacted by budget stuff as well. Upon release, we'll work with our partners at ATSDR to make sure that people are aware that the document is available. And I don't know for certain, but I would imagine similar to when the private well health consultation was released, will probably help them with a public meeting. And then the last update that I wanted to give is that several New Hampshire DES staff participated in a meeting this morning with the team at Dartmouth that's working on the phase 3 feasibility study relative to higher than expected rate of kidney cancer in Merrimack. Our department is committed to supporting Dartmouth and DHHS in this work, and we'll be sharing environmental quality data with them from all 3 of our divisions. Okay, those are all my updates. Oh, Nancy,
Representative
go for it.
Murphy.
Oh, thanks. I just want to clarify. I know I heard a lot of discussion about that facility in Nashua, that proposed facility in Nashua. And I know there's a lot of concern that it's located in the heart of the city and about the environmental impacts to public health. And I know there was a question as to why would DES even consider issuing a permit. So what you're saying, if I get it right, Karen, is that even if DES issued the permit, if the town refuses or the city refuses, then that doesn't go forward. Is that correct?
Yeah, yeah. So, you know, I want to be careful to not speak for our air permitting
Yeah.
team, but I think I have enough of an understanding of the process and have worked with them on this particular project. You know, the scope of what's considered in reviewing a permit application is very specific, and there, you know, are statutes and rules. And so it's essentially is criteria met or not? Yes, no. You know, they're reviewing against certain air quality standards. And so that review of the permit application has to, once we're in receipt of an application, review and issuing a decision, we're bound by statute to do that. You know, a decision has not been issued yet, but it's a very parallel process to the, you know, the approval that the city has to give, and the two don't impact each other, but both are needed to move forward.
Okay. All right. So, and on the DES permitting part, how much, I mean, is it just in terms of weighted? I know there's certain like criteria that you said, but what's the impact to public health? How is that weighted? I mean, I get this. Okay, go ahead.
It's
Sorry.
well, so it's worked into, no, that's okay. I started to
Yep.
think through it before you finish. So if there's more that you want to say, definitely. It's worked into the air quality standards that permit applications are reviewed against, right? So if certain criteria can be met, it's not expected that a facility, you know, if it was operating within the constraints of that permit, would pose a risk to public health.
I just go back to, you know, St. Gobain, and, you know, they get permits for how long, and there was a risk to public health. So I know Nashua, I've heard from a lot of the reps from Nashua, as well as some citizens from Nashua, and they're really concerned about that. So that helps me understand. Thank you. And then there was one other thing that you had mentioned.
Can I add one more thing
Sure,
just
yeah.
about that? So in terms of the process, so again, you know, a decision hasn't been issued yet, but you know, when the department issues a decision on a permit application, then there's a public comment period. And then if, you know, there's response to those comments, and then a final decision, and then decisions can be appealed to the Air Resources Council. And that whole process was laid out to the community because we wanted to make sure that everyone knows how they can become engaged in this process.
Yeah, we've been through that a couple of times. I remember. Thanks, Karen.
Any other questions for Karen? Oh. Dr. Kazadi, are you getting ready to ask one? Okay.
No,
Thank you, Karen, for your update. Michelle?
Sure, I have a few updates as well. I can start off with the Merrimack Kidney Cancer Phase 3 feasibility study. So Dartmouth and DHHS have been working with partners to identify and assemble a steering committee, a scientific advisory board, and a community advisory board for input on this project. In particular, we're working very closely with the HB 737 Commission for recommendations for memberships. And I know several of you are also on that commission as well. And Leanne Atwell, who works here at the health department, sits on that commission as a DHHS representative. In preparation for the initial meetings with the board and the committees, the Dartmouth team has begun compiling different study designs and is identifying what environmental data are available for review and analysis. And that's one of the meetings that Karen spoke about this morning, is reaching out to DES to see what data is available. They are also reaching out to the health department and other folks within our agency as well for data. So more to come on that, but I just wanted to give you an update on, where things are going since that project got approval through governor and council. We're trying to hit the ground running and really make progress on that study. So stay tuned there. I just wanted to let folks know, I talked about ATSDR updated their PFAS guidance for clinicians, and I just wanted to give you a quick update. So they updated it on January 18th of 2024, and that is available on their website. I can drop some links into the chat. DHHS and Dartmouth are reviewing the updated guidance, and we'll be evaluating what updates might be needed to the New Hampshire specific clinician guidance, which is largely based on ATSDR's 2019 guidance. So we are looking at that and do expect to have some updates to our clinician guidance as well. So as soon as that is publicly available, I certainly can share it with the commission. I wanted to also let you know about a recent initiative that we've partnered with DES on. So as a result of changes to RSA 485-17A, which is the lead in drinking water in schools and licensed child care facilities statute, DHHS partnered with DES to provide grant funding to licensed child care facilities to support compliance with the new requirements in the statute. This includes providing free drinking water testing and funding to support lead and drinking water remediation projects. So DES has the lead and drinking water program that we're sort of partnering with. The department received $400,000 of funding from the New Hampshire Drinking Water Groundwater Trust Fund to support lead in drinking water remediation projects at licensed child care facilities. So the remediation grant funding was approved by Governor and Council on January 31st, 2024. So we're in the process of standing up this grant program. We're collaborating with the department's child care licensing unit and the Bureau of Child Development and Head Start collaboration for outreach opportunities. And we're also collaborating with the Bureau of Child Development and Head Start collaborations to include some free water testing and funding for remediation projects as part of their standing up what they're calling the Child Care Business Improvement Project, with ARPA funding that they receive. So we've worked pretty closely with them to allow some of that ARPA funding to support drinking water testing and remediation projects at licensed child care facilities. And the nice thing about that funding is that it's not just related to lead, it's all contaminants. So what we know of in working with our child care licensing unit is there's a total of about 700 licensed child care facilities in New Hampshire. Of that, about 80 to 100 have are on private wells. And so that money can really help with those facilities to provide free testing for not just lead, all contaminants, and then provide funding for remediation projects beyond just lead. So the original $400,000 that I talked about earlier from the Drinking Water Groundwater Trust is really focused on lead remediation projects, and that's the only we can only use that money to support lead remediation. But this other pot of money is able to help child care facilities with water remediation projects beyond lead. So that's some great news there. And the last thing I wanted to just share, Silent Springs Institute reached out to us and asked if we could spread the word on their recruitment for their PFAS REACH Children's Health Study. And that REACH stands for Research, Education, and Action for Community Health. The study is focused on 2 communities where public drinking water wells have been contaminated with PFAS. One of those communities is at the Pease International Trade Port, formerly the Pease Air Force Base, and the other community is in Hyannis on Cape Cod in Massachusetts. I have a flyer for them that I will forward along to Mindy along with the radon slides for your information. It has contact information, who's eligible for the Pease location, are children ages 4 to 8 and 11 to 15 who attended daycare at Pease or whose mothers worked at Pease before 2014. So I can send that flyer along for your information. If you can get the word out, I know they would be grateful for that. And that's all I have, and I'm happy to answer any questions.
Any questions for Michelle? Okay, great. Thank you so much for that update, Michelle. Really appreciate it. And yes, please, you and Karen, if you want to forward some notes over to me, I'll pass them to the commission after, along with when we have a confirmed date slot for the in-person part of the meeting next month. So don't bombard people with too many emails.
One thing I did want to ask, if it's okay, if I can just ask a quick question of the commission. Next month, I believe Gail Gettens from our Healthy Homes Lead Poisoning Prevention Program is providing a presentation. Would you like, is there anything specific that you want her to present on, or just kind of an overview of our program and data, kind of similar to what Lynn did? I just want to make sure we're capturing anything that you might be interested in. And if you want, you can let me, if you can't think of it right now, if you want to let me know in the next week, that would be great.
Yeah, I guess one of my concerns is the uptake in the testing rates. Has it improved since the pandemic? Because I know they really torpedoed during the pandemic, and what's going on with that, those testing requirements across the state. And if we could do, you know, one of the times 2 years ago, Nancy and I were on the commission, we got the community updates by community too. That was helpful. I think so, full state level and then by community, so that each of us can go back to our communities and or at least have an understanding of what's happening in our communities regarding that. That would be great.
Yeah, I believe our data brief has that information, so we can certainly share that. And actually, I will also include a link. I don't know if Lynn mentioned the radon data brief, so I can also do that as well. Thank you.
Great. Thank you so much. So next on the agenda is an update from Peg on education. If there's anything you want to say, I'm just leaving a slot if you want to update us on the education committee.
Well, I think where we're at right now is, Mindy, you have the draft of the letter. So just to kind of review, the education subcommittee's goal is to provide education, particularly on PFAS chemicals, but on contaminants in general, to the clinical providers in the state of New Hampshire. We started with the nurse practitioner community, and there's been a team that's presented the last 2 years at the Northeast Nurse Practitioner Association conference. We'd like to use that same model of the trio of presenters, which involves Representative Murphy, Dr. Romano from Dartmouth, and Jonathan Patali, the state toxicologist. But we've been struggling with how to reach the physician community. What's the best avenue? And the most recent ideas that we had were to draft a letter to present, to send to particularly the CEOs of hospitals in the southern tier, where the PFAS contamination is the worst, and just basically ask what their ideas are for ways in which we could present to their clinical staff, whether that was through rounds or some other mechanism. So it's nice to have both Dr. Timmons and Dr. Casal here now, because you might have other ideas about ways in which we can approach this. The letter is in draft form. And I think, Mindy, will that be going out, the draft for review by the commissioner members, or where are we at with that?
I know we saw it and several people gave some comments, but if maybe we should hear from Dr. Kazal and Dr. Timmons if they have any suggestions for how to go about this. And then certainly we should send it to the full commission for comment. If I thought it kind of was, but maybe it wasn't.
No, well, it had been reviewed by the education subcommittee members, but then I sent it to you, not knowing whether or not it
Got it.
needed to be approved through the whole commission. So that's where.
Got it.
Have
Dr.
you
Kazal, you're
considered
on
also,
mute. Yeah.
have you also
You're all set.
considered working? Have you also considered working through the New Hampshire Medical Society?
Yeah, so we talked about it, but we didn't really have a contact there. So is that something that maybe you would be willing to help us, guide us in that direction, or be the liaison there?
Sure. I'm not on the board, or I don't hold any positions there, but I know enough people. I'm on the board of the New Hampshire Academy of Family Physicians. And both those societies work very closely together.
So how would we best go about that, Dr. Kazal?
If you had a letter with what your goals are, what you're trying to accomplish,
Mm.
and I can look at that and see how to tailor that, edit it to so that the New Hampshire Medical Society might see value or a way to help out as well. And then let you see that, make sure it's all right with you, and then I could get it to the right people and get feedback.
Sounds great. We can do that.
So Peg, do you want me to send that to Dr. Kazal and Dr. Timmons, or do you want to do that? Either way is fine with me, to get comments from them.
Oh, I certainly can send it, Mindy. Take it off your plate. Yeah, I'll
Perfect.
do that. Okay. But that's where we are.
Excellent. Yes.
We're all set to present again. We're all set to present to the Nurse Practitioner Association conference again in April. So this will be year 3. And we want to add these other avenues to educate clinicians. So, okay.
So I'm gonna, since Peg is so modest, I'm gonna talk a little bit about the importance of that. And really, Peg spearheaded this 3 years ago, and took this on as to give presentations at the annual meetings of the Northern, what is it called again? Northern Nurse Practitioners Association, right?
Northern New England.
And yes. And the first year it was a presentation at the end of the meeting, and the second and third years it became more prominent, and the very, very good feedback from those nurse practitioners on the level of information that they received. And I believe there were lots of questions. And so it's really an amazing effort to try to reach out about the importance of environmental triggered disease in the state of New Hampshire. So it'd be wonderful if they can make those connections with other physicians across the state, so that, one of the things that we've always heard, both in my community in the Seacoast and also in the Merrimack, Southern New Hampshire area, is physicians are really unaware of some of these environmental issues, especially in Southern New Hampshire and the Seacoast. So this was an amazing effort by Peg and Representative Murphy and others to really bring that information directly to the people who are dealing with patients on a day-to-day basis. So it's an amazing thing that these guys have been able to do. So we'd really like to see that happen in terms of connecting with other physicians as well. Dr. Timmons, I think I saw you go off mute for a second. Oh, go ahead, Dr. Kazal.
The New Hampshire Academy of Family Physicians in May has their annual meeting. The agenda is already set. The speakers are already there. There are breakout rooms where there's people have posters. Various companies are there because we need the support to be able to pay for the meeting. So various pharmaceutical companies are are there, and so I don't know if you have anything on an easel that's easy to read and one on a table, and I'm sure the doctors would much rather come by and learn something than have the pharmaceutical reps chasing them.
When is that meeting? May?
Oh, I think it's the week after, when's Mother's Day? Because last year we made a mistake and had a meeting on the weekend of Mother's Day. That wasn't great. Let me
Mother's
quickly.
Day is May 12th.
Yeah, so that's my memory too. So I think this meeting is the 20th and 21st. And by the time we get off, I can tell you for sure.
Okay. I mean, Peg, if you want, I'd be happy to help you do a poster, or I wonder if DES and DHHS could provide some fact sheets, copies of fact sheets to put on a table. I'd happy to go there with you, or whoever, if anybody else wants to go, that would be great too.
I think that's a great idea. We've been trying for so long to get some interaction with New Hampshire Medical Society. That's a great step, and that way people can come to us if they're interested. It's probably the best
So
way.
the meeting is 19 through 21.
Okay.
And I don't run this, so I can't, just because I'm suggesting this, that it's not a guarantee, but I'll be really upset if I can't get folks to agree. So
We're
Thank you.
counting on you.
Yeah.
Awesome.
good.
That's great.
I can have
Dr. Timmons, did you?
I can have an answer by early next week. Especially if you have anything, even just a short paragraph that I can get to the president of the academy and get things rolling. Because it'll have to go through our committee for medical education, and but we're not that big a group, so we can handle it.
Okay, we'll get that to you, Dr. Kazan.
Any other comments or questions? Dr. Timmons, did you have anything to add? Is there any
No,
meetings or anybody?
no, I was just going to ask where we were at, if anybody had been in contact with NHMS, so that answered that question. So,
Mindy,
Yes, Dr. LaPresca.
I don't know, Peg, have you seen the PFAS information for clinicians that the CDC and the Agency for Toxic Substances and Disease Registry put out?
I've not seen the revised guidelines that Michelle spoke about, or Karen did.
Because it really is, there's, I think it's very good. I actually went recently to that PEAS meeting back in January where Dr. Aaron Bernstein spoke about it. He's from Harvard, and so he is, going to these, to pediatricians and going to these medical societies. I don't know if you've heard of him or met him.
I've heard of it, but I've not met him. Yeah.
Okay, but you should, I think at the last meeting, they did provide a link for that clinician, but that may be something you can give to the New Hampshire Medical Society, or, the Dr. Kazal here. Mindy, I believe you have it, or I can send it to you if.
Karen just put it on the link on the chat, and I put it in the notes too.
Yeah, so it's very clear, and maybe something you want to look at.
Well,
Thanks.
certainly it would be helpful if we could plan well in advance for the future. We can identify places where the information can be, presented, and get those things in place now, so that, we can cover a lot of bases. So thank you. Dr. Draconis, for that. I'll look for that.
Anything else, Peg, that you want to cover?
I think that's it. Yeah.
Okay.
That's good.
Thank you so much.
Yep.
Now I'm going to put Representative Mons on the spot for his update on Coakley Landfill Subcommittee.
I thought you were going to put Representative Murphy and I on the spot for legislative review.
Well, either way. Oh yeah, that's what's next. Yep. Sorry, I skipped it. Go for it.
Because-
Whichever one you want to do first.
Because we're ready for that.
Okay, go for it.
I want to just share my screen. So can you all see that? Can you see that lovely spreadsheet?
Yes.
This is a, I'm not even gonna attempt to take credit for this. This is, something that Representative David Muse put together and has been putting together for several years. And he forwarded it and, you know, I thought I could share this with you. I mean, it's basically a summary of all of the environmental related bills for, that are being considered at the present time. These are the environmental bills out of the total of about 1,200 bills that the legislature is plowing through right now. I mean, I took a look at these, and I'm not going to pretend to be an expert on any of them. And Representative Murphy's probably more up on this stuff than I am, but I thought I might just highlight a few for you. And as I'm going through here, Nancy, just, you know, shout out if there's any others that you want to call people's attention to. The first would be HB 242, which is a bill that bans the use of food packaging containing PFAS. That has been referred to interim study, so it's not quite dead yet, but it's on life support. And hopefully it'll be, you know, there'll be some opportunity to re-examine it. The next one is HB 398, which is a bill that requires certain notice of PFAS and other groundwater contamination prior to the sale of a real property. So that has been, that was approved. That was passed on a voice vote in the House. So that, you know, looks at least on the surface to be encouraging, and it goes to the Senate next. Right below that is HB 414, which requires insurance coverage for preventive PFAS care. That was voted as inexpedient to legislate, so that is now dead. On the next page at the top, HB 1089, that removes the statute of limitations for civil action for damages resulting from PFAS exposure. That is still in committee. House Judiciary is hearing that. So we'll want to kind of keep an eye on that one. Couple rows down, HB 1114. This bill extends for 5 years the commission to investigate the public health impacts relating to release of PFAS in Merrimack, Bedford, Londonderry, and Litchfield. So that is one of our sister commissions. And that's still in committee. Down further.
Wait, Chris, can I just add something there?
Sure.
HB 1114 is one of my bills, and it was heard in committee, and Representative Renzullo, who's the chair of resources, asked that an amendment be approved, which we did. So and it passed committee. Actually, I think I think we did the exec right after the meeting. And that passed, but we have now added Hudson as well. So the commission will include Hudson as well as Merrimack, Bedford, Londonderry, and Litchfield. So that's well supported. It's got good Senate support, as well as the House, and bipartisan. So I think that bill's in pretty good shape.
Good.
Sorry, go ahead.
Yep. 1170, scrolling down, requires the Department of Environmental Services to conduct public benefit and community impact assessments. That one is in the Environment and Agriculture Committee. It's still in committee. I don't know a lot about it, but it looks like it's something that we need to keep an eye on. 1293 prohibits the use of fertilizers using phosphorus. HB 1415, which is a bill that provides for PFAS facility liability for contamination of groundwater quality standards according to federal regulations. That's still in committee.
Okay, add to that, that's another one of my bills.
Okay.
That one we had the public hearing on. I think there were 3 or 4 lobbyists there who, after we testified, chose not to speak. And that was the only opposition to that bill. That this bill will actually will hold polluters, PFAS facilities, which are defined in that bill, accountable to federal regulations if they're the PFAS in groundwater exceeds AGQS for the regulated PFAS that we have here in New Hampshire. So I'm hopeful of that one. Again, it's bipartisan, and I think the resources really heard this, and we explained why. One of the things that I said is that we lobbyists are there to advocate for the polluters, but it is the responsibility of the representatives to advocate for the impacted citizens. And the state of New Hampshire really needs to be listening to the people and not the polluters. So fingers crossed, hopefully that will make it out of there. I think it will. But again, we never know. Sorry,
And
Chris.
nope, no problem. No, that's why I wanted you to on here. So right below that, sorry, I lost track of where we are. 1477, it directs the commissioner to develop a program requiring environmental surety bonds for businesses that pose a significant risk. Is that, do you know anything about that one, Nancy? You're muted. You're muted.
Sorry, I don't. Yeah, no, I don't know about
Okay.
that. I know
All
a
right.
little bit more about 1613, but not that one.
Well, take it away on 1613.
Okay, that's David Muse's bill, and the goal of this bill was to have a place for funds from court settlements and legal action to go, so that money wasn't just put into a general fund and dispersed to things that might not be related to the purpose of the litigation to begin with. And I know, I'm pretty sure DES came to, I don't know if they didn't take a position or they opposed it, but they might have not taken a position, but explained some of the concerns that they had, that they wanted to be able to do things like when the MTBE lawsuit money came in, and they were able to test for PFAS at the same time with those funds. So they were concerned that something like that might be problematic if this bill were to pass. Again, that I don't think there's been an exec on this one yet, but again, we'll see.
And I remember talking to David about this, and I think this was in direct response to, wasn't there a settlement last year where the money, got disappeared into the general fund?
Quite possibly.
Yeah, I can't remember which one it was.
More than
but,
one time.
Yeah.
Yeah.
And then, wrapping up here, 1649, which restricts the use of PFAS in certain consumer products sold in New Hampshire. That passed out of committee, and there's a House vote coming, so that's encouraging.
Right, that's Karen Ebel's bill, and I think I was with her. It was 16-3. It passed out of Commerce, and I know there was some amendments that she agreed to for this bill, but it was interesting during the public hearing when we testified. I remember actually remarking that of all of those that testified, there were only 2 that did not support, and the vast majority were in support of this bill. One of them was a lobbyist for I can't remember who, and the other was a lobbyist that was sent from Washington D.C., a PFAS something group, which the name would lead you to believe that they were working towards PFAS protections, but didn't seem to be. That wasn't the testimony that they did. But it was just interesting. I thought back 8 years ago, it was a very different scenario, and I'm sure, Mindy, when you were there, it was even this. I leaned over and I remarked about you, and I said it's a very different experience than you would have experienced back in the day. So we've come a long way. That there are far more legislators that are aware, even if they're not, their constituents are, and are asking, what are you doing about this? So I'd like to see this. I think pretty sure DES supports this bill, and recognize that we've got a Commerce is the place to start addressing this, and at least it's on its way to the full House for a vote.
HB 1707 was a bill that would have required the owner of a PFAS facility that was generating PFAS to pay for blood tests. That was ruled inexpedient to legislate.
That one too is another one of my bills.
Okay.
And that one was ITL because I asked that it be. That it says nothing about the validity of the need for this testing. It's just right now there are some class action lawsuits happening, and I was concerned that whatever happened, this bill could be not necessarily helpful in terms of the class action lawsuit. So I withdrew it. Well, I couldn't withdraw it. I had to ask that it be ITL'd so that it didn't go forward. So it wasn't that was at my request.
Okay.
Sure.
And then HR 28, is that the resolution that would that's directed at Washington and France and dealing with Saint-Gobain?
I don't know. I don't believe so. That's wait a minute. Let's see. Urgent for compensation. I don't believe that has anything to do with compensation for injuries. That's Wendy Thomas's bill that I think, Chris, that you're talking about, right?
Yeah.
Yeah. And I don't, it is a House resolution, but I didn't think it was, I don't know. That might be it. That might be it.
Well, it passed out of committee, so it's coming up to the floor. And then the last one that I'd just highlight here is the last bill, SB 413, and this again relates to civil actions for PFAS contamination, and that's in committee. So again, I have to thank David Muse for pulling this together, and also thank God that Nancy was on the call here to add some color to some of these things. So hopefully
Teamwork, Chris.
that
Teamwork.
helps. Hopefully that helps. And Mindy, if it's worthwhile, I can forward this to you.
I also got a copy of it, so I was gonna
Okay.
ask if it made sense for me to upload it to a Google Drive or something so that people can see it or upload or changes or whatever. Is that helpful? do you
Yeah, I
think?
know we had talked about that. I guess I just would want to, since it was David's creation, I just want to make sure he's comfortable with that. So,
Yeah.
um,
I'll ask him, or you can ask him,
Okay.
whatever you want.
okay. No, if you want to ask him, that'd be great.
Okay,
Okay.
sounds good.
So that's,
Anything else on legislation? Thank you so much for that comprehensive review.
oh, you're welcome.
Any
we'll
questions
s-
from the commission? Sorry. Oh, okay. Well, Chris, you're on the spot again for the Coakley update, or is it
Yeah,
Rosalie?
I like your assistant there.
I know,
Um,
he's getting frustrated with me.
I'm gonna share another document if I can find it. Hold on for a
Absolutely.
second. Just hang on. I got too many things open here. Okay, hold on. Just bear with me. Oh my God. Come on. I'm getting there. There we go. Okay. So can you see this?
Yes.
Okay. So I had alluded to this last month when we talked. And this is the letter that I received a copy of from the commissioner of DES. It's in response to a request I had made for a kind of a summary of, where things, what's been done and where do things stand with the Coakley landfill and, probably most importantly, what are we doing? What's the plan going forward? I think when we spoke last month, I had said that I hadn't had a chance to really review it in depth, and I think David Muse had spent a little bit more time looking at it than I had. And I did spend some more time looking at it leading up to this meeting, and I also circulated it to the other members of our Oakley landfill subcommittee. And Dr. LaPresto spent quite a bit of time looking at it as well. I am hoping to connect with Mike Wimsett from DES. I'm hoping to connect with him early next week to share some of the questions or concerns that I had with the letter, and also that Rosalie had with the letter, and also follow up with him on what I thought we had discussed in terms of next steps following the release of this letter. And those two significant next steps would be a kind of a meeting with, the legislators representing the area that this covers. And then also, a public meeting where people would have an opportunity to receive an update and ask questions. So I'm hoping that I'll get some guidance or some clarity from him on where we're headed. In terms of, what's in this letter, and, it's a lengthy letter covering a lot of things with a lot of references to studies that have been done. And you can see highlighted in red are my questions, and highlighted in purple are Rosalie's questions. And I'm not going to try to go through them all in great detail. I'll try to summarize them, and then, Rosalie, I'll let you comment if I haven't done it justice. But I mean, I think the concerns that I have, that, we have, fall into several different categories. There's a concern, and Rosalie is really focused in on this, the concern about the downstream impact on, the Bailey's Brook and Barry's Brook. Barry's Brook gets a lot of focus. Bailey's Brook doesn't get as nearly as much focus. And there's a lot of questions there about, what the impact has been. And that gets into the questions about the sampling methodology that's being used, and the validity of, tests that were done 6 years ago. How do they, how accurate are they still today? So lots of questions about that. There's questions about, the lack of surface water standards. As I understand it, and Mindy, you probably have much more insight into this than I do, that, the legislature, in the letter, it refers to the fact that the legislature directed in 2018 that surface water standards be set. And those standards have yet to be set. So I guess my question is, well, why is it taking so long? And where's the problem? Is it within the joint legislative, rule setting body, or what's going on? Because on the one hand, I'm hearing that, there, on the one hand, it appears that there may be some surface water issues, but on the other hand, I'm hearing, well, there's no standard to test against, so, we can't do anything about it. So we want to find out what's going on with the surface water standards. And then, Rosalie identified, that she had identified that there was, or had raised some questions about foam, and the presence of PFAS and or contaminants in the foam. And then, to her credit, I mean, she identified the fact that, there is data that suggests that the concentrations in foam may be even higher than it is in surface water. And so shouldn't we be testing for foam, and shouldn't we have standards for foam? So, and some other states do have standards for foam. So that's kind of all under the heading of, testing standards. One of the things that I was struck with when I read the report was, several references made to the unlined stormwater retention basins, and the fact that there's runoff, that it's known now that there is contamination in the topsoil that was used on the landfill, and that the rainwater off of that topsoil is running into the unlined retention basin, and the water is then seeping into the groundwater. And it kind of begs a couple questions in my mind. Well, if we know that's all happening, why at a minimum haven't we lined the stormwater retention basins? I know it's difficult to put a liner on a landfill, but the stormwater retention basin, you should be able to do that. So why haven't we put a liner there? And then the other thing is, if we know that water is getting out of the stormwater retention basin into the watershed, why aren't we trying to control that? And then I guess the bigger, and those to me, yeah, those cost money, but they seem to be relatively inexpensive. And the bigger question I guess I have is, if we know that there's contaminants on the topsoil in the landfill, why haven't we removed the topsoil and replaced it? So, and that gets to the bigger question of, well, what are we doing to finally fix the problem? And then the last general area of concern.
Can I interrupt you for 1 second?
Sure.
Representative Munns, can you
Yep.
you widen that letter all the way over? Thank you. Yeah, just pull it over.
Okay.
Thanks.
And the last area of concern I have, and then I'll shut up, is just, kind of, what is the oversight of the Coakley Landfill Group? I mean, there was one reference where, um, you know, the EPA had asked for one thing and, and the Coakley landfill group did something and seems like arbitrarily they made a decision not to follow that. And I was like, well, did anybody, you know, have oversight of them? So I know that's all kind of, you know, vague, and I'm sure a lot of people's eyes are glossing over, but that's just a general reaction. And Rosalie, anything you want to add to that?
Thank you. You did an excellent job. You actually read all the comments that I made, Chris.
I did.
So I
And
went
I learned
into
something.
depth. I went into a lot of depth on certain aspects that affect the town I live in. And I was frustrated specifically with that map identifier 4, because that was the main reason why the results from 4 taken in 2016, the sampling from that date, is the reason why they feel they don't need to test Berry's Brook with distance. So I started thinking about what, who did this sampling, and it was Conservation Law Foundation. And when I spoke with Tom Irwin, the vice president, who did give me permission to mention his name and to discuss this, he could not recover that exact sample. He was able to recover all the other samples that they did and all the documentation, but not that one. So then that begs the question is, we really need to, we are hoping that data gets shared with us. And then I guess, it's just frustrating, what set of circumstances need to happen before, DS orders remediation required in House Bill 494. Another thing on Google, if you look at swimming holes in Rye, and I mentioned this in the report, what comes up is Berry's Brook, which they labeled as Sagamore Creek. I certainly would not want to be swimming in that water, or allow the pets in that water. So a lot of questions, and it would be nice to get some of those answers. Thank you, Chris.
Yep.
So we'll be looking forward to a meeting with DES and then a public meeting with DES. Is that where the plan moving forward might be?
That's what that's what I'm hoping. I get the point I made to the folks at DES that I was talking to is that I said, I think it would be in DES's best interest if they were to convene that meeting as a way of kind of, reconnecting with the people in the area that are concerned about this and giving them an update and telling them what's happening. I'm hopeful that will happen, and we'll see. The other, one
So
other
just-
concern. I'm sorry.
No, go ahead.
No, one other concern that I mentioned in here, it's kind of a general concern, and there's this the rail trail is being finalized. It's going to open soon, and the rail trail goes right by this area, and I have to believe, given some of the data that we have, that we need to make doubly sure that we've got the right kind of fencing and signage to keep people away from the water and the site. So that's another issue I'd want to make sure we raise.
I just want to make comment on that last issue for a second. So that your points about the lack of liner on the stormwater retention ponds and the water, the stuff coming off the landfill, not just from the topsoil, but I contend it's coming from the landfill itself, going into those stormwater retention ponds. But it overflows and there's no control whatsoever on any of
Right.
that. It just goes right into the headlands of Little River and Berries Brook. So that's
Right.
a real concern, especially when, you know, currently it overflows the trail to begin with, and what's going to happen during those high rain events that when the trail is open. So I share your concerns, and we had EPA put a couple of signs up along there, but there's no protection and there's no other warning in those areas where it routinely floods. So I share your concern about that. One thing that may have an impact on this is, you know, EPA proposed last couple of weeks to add PFAS, certain PFAS to the RCRA facility regulations. And they had proposed before to also add them to CERCLA as listed hazardous waste, at least some of them. And the MCLs are supposed to be coming out this quarter. And I've heard that they're in final review right now with EPA. So the MCLs, if they're what we think and hope they will be, as proposed by EPA, and the fact that those perhaps will be added as CERCLA hazardous waste, that may push things a little bit, because if one thing EPA has said all along is they don't have the regulatory authority to act on PFAS here because it's not a listed hazardous waste and there's no MCL. So that might have an impact on this site in the future if that actually does happen. But it is very frustrating that when there's clearly New Hampshire you know, that was HB 494 asked, you know, specifically set out the state's authority to do so, and they have full authority under our regulations to do something that they have not. And the surface water regulations, I share your frustration. That was my bill in 2018 that, you know, DES did report on how they could regulate surface water in New Hampshire, and the conclusions of that were that, you know, there's certain low hanging fruit that could be enacted fairly quickly, and none of that has happened. So
Yep.
Happy to see that maybe, you know, there at least might be some public meeting or some meetings about this in the future.
So
Thanks for doing that, Chris.
one quick question for you, Rosalie, before, since we're on the call together. You don't have any objection to my sharing your specific wording with Mike Wimsett, do you?
No, not at all.
Okay, great.
Unless I
Okay.
said something that, you know, may
Well,
not be so
I haven't had
welcomed.
time to look at it yet. So Chris, when's
But,
your schedule for doing that?
We're connecting on Tuesday, so what I'll do when Mindy, I'll send you the latest draft that has both of our comments in it.
Cool.
Just don't add a lot of really technical stuff, because I have to then try to explain it, you know, and that's
No problem.
way above my pay grade.
But
Thank you.
I think it's genius that you thought of. I mean, is there, Mindy, liners for stormwater basins?
Sure.
Okay.
I mean, that
Liners
Wow,
for
it seems-
stormwater basins.
when I saw that, I mean, that seems like such a simple solution that's not that expensive, because those stormwater basins are
No.
not that big.
That's not the part of it that's a problem. The part is if they put liners in, there still is no treatment or control of
Right.
what's coming
Yeah.
out of the,
Yeah.
there's
That's-
nothing there. So that's
Yeah.
why there's
Yeah, you
no
gotta have, yeah.
control
right.
or treatment of the outflow.
Right. So,
Great.
okay,
Well, thank you. We'll be looking forward to an update again, and let us know what happens with that in the future. Thank you,
Yep.
Chris and
you're
Rosalie.
welcome. You're
Thank
welcome.
you, Chris.
You're welcome.
you.
Thank you, Rosalie.
All right, so that brings us to the end of our agenda. Is there any other new business that people want to raise before we, other than the upcoming meetings which are listed in the agenda? And we'll confirm either Merrimack or Hampton will be the next in-place location for that next meeting. And as soon as that happens, I'll send out the notice to the commission, as well as the notes from this meeting that I received from the agencies. Any other new business raised that anybody wants to raise before we adjourn?
Well, I just have something, a quick question. Have you ever had anyone lecture about manganese in the water? Because this,
No, we haven't, but that is a big issue.
I really would be interested in that because we do have a pilot study, $50,000 grant to study the iron and manganese in our water for the treatment plant, and apparently there was a limit set at 0.3, and now there's pushback, and there was never a standard in the state of New Hampshire, and we do know elevated levels of manganese can cause ALS from that last lecture you had, and also neuromuscular and developmental disorders. So I thought it would be an interesting topic. Thank you.
That's a great idea. I'm trying to look and see. Is that something, Karen, that maybe Melissa could cover? Yeah. Okay, cool.
I was
Let's add that
gonna
to the.
Oh, so Melissa from biomonitoring. I'm not sure. I'll let Michelle answer that. I'm not sure that would be in her wheelhouse. I was going to suggest that perhaps Brandon Kernan and Jonathan Patali could come combined to talk about manganese in water and health effects of manganese.
Yeah, I think that's more a DES issue. I mean, Melissa will be talking about the biomonitoring study, so she may have some information relative to the study. I'll let her talk, but I think in terms of regulating that falls more to DES.
Mindy, I have to apologize. I have to run.
Okay.
So
Yes.
thank
right.
you, everyone. Have a good weekend. Stay warm, and see you next month.
That's all I had to. So if no one else has anything else, we can adjourn. Seeing none,
Thank you.
Thank you so much, everyone. Have a great weekend.
Have a great